This comes up at the doors a lot. People are really frustrated with the healthcare system. It's been stretched to the brink, and nurses and doctors, especially nurses, they're leaving in droves, and we need them. We desperately need them. But when you treat people like this, it's no surprise that they're not going to want to stay. So obviously we would repeal Bill 124. That's what caps public sector wages, particularly nurses. And so Ford kept talking out of both sides of his mouth. They're heroes, and yet we can't compensate them. A lot of them had to work double shifts. They weren't paid overtime, huge burnout. You have mental health issues because not only are they working so much, but think about what nurses were doing. They were kind of like I said, holding up an iPad so somebody can say goodbye to their family. Like that would have been traumatizing for them as well. And we aren't recognizing that. And it does not go unnoticed, I have to say, that the wage capping is in very female-dominated jobs. It's teachers, it's nurses, and that sort of thing. And it's very frustrating when you think about it. The Ontario Liberals want to invest $1 billion to clear the surgical backlog. Doug Ford already mentioned, I think actually it was Christine Elliott, that they would use private healthcare to help clear that backlog. We would not do that. We're going to invest in our hospitals and clear that surgical backlog within 2 years. Not only are we going to invest $1 billion to clear the surgical backlog, but we're going to invest in people. We want to hire 100,000 healthcare workers over the next few years to help us fix our healthcare system. We need that investment in people because it's one thing to build a hospital, but it's another thing to staff that hospital. If there's nobody there to care for the patients, then it's kind of useless. It's pointless. So we need to make sure that we take care of the people who are actually in the hospitals doing all this work.